going to talk on laparoscopic myomectomy. Myomectomy is still the most preferred treatment for symptomatic fibroids in women who wish to retain their fertility. Since its first description in 1977, laparoscopic myomectomy has gained considerable popularity and is now performed by a large number of clinicians in India and worldwide. However, it remains a challenging procedure and requires advanced laparoscopy skill. However, everybody wants in metros laparoscopic procedure. Laparoscopic myomectomy is associated with reduced blood loss, lower hemoglobin drop, less postoperative pain, 24 hours hospital stay, and recovery period is short. There's a lower risk of complications in comparison to open myomectomy. This particular statement of various studies, I do not agree because one has to be competent whether you do open myomectomy, or do laparoscopic myomectomy. Only a skilled person should be doing it. How do we diagnose it? Patient who is symptomatic, it can be easily picked up by good transvaginal sonography. Whenever you are in doubt, my MRI can be done to differentiate fibroids from adenomyosis. Some mucous fibroids can be easily picked up by saline infusion sonography and by hysteroscopy, and it helps them for appropriate patient selection. Preoperative shrinkage of very large fibroids with either GnRH analog or mifepristone um, is likely to be beneficial. As for the management is concerned, I will again say your competence is important whether you want to do open myomectomy or laparoscopic myomectomy. Few approaches are likely to improve the success of operation and reduce the risk of complications. In laparoscopic myomectomy, appropriate port placement is necessary to leave the good distance between the laparoscope and the uterus. It is good to use intraoperative vasoconstructive agents like diluted vasopressin. It is injected into the myometrium and the blood loss is significantly less during the surgery. As for the removal of fibroids are concerned, if you're in the right plane, it is as easy as is found in open myomectomy. Use of large curved needles to repair the myometrial defect in multiple layers is necessary. One can use even barbed suture, which avoids not to be done repeatedly. The use of excessive diathermy to be avoided, and a good repair of the myometrial defect should be done to reduce the risk of future uterine rupture. Use of electromechanical morcellators is needed whenever the fibroids are of big size. So, surgeons should follow the principles and appropriate training before attempting the procedure and receive mentoring during the initial stages of their learning curve. Thank you very much.